I'm with Dianne Glasscoe Watterson, who is a columnist for RDH Magazine. Her column is titled Staff or X, and it appears every month in RDH Magazine. In the upcoming February issue of RDH, her column is titled Handling a Co-Worker's Departure. And in this particular column, a reader was talking about working in a dental practice where a hygienist left the practice, and the official reason given was that the hygienist was going to work in a nearby town for another dentist. But there was discussion among workers about some health problems that this hygienist had, and the hygienist was popular with other patients. So when a patient came in and asked where her former hygienist was, after a certain amount of conversation, the hygienist started talking about some of the issues regarding her former colleague. Her former colleague then called her former boss and said that there was a HIPAA violation that had occurred. So I want to ask Dan, first of all, we probably should clarify what HIPAA is. And Diane, I think of HIPAA has been and Diane talks about this in a column. I think of HIPAA has been the electronic transfer of patient information, not conversations regarding fellow employees. Can you clarify this particular issue for us?
Yes, Mark. HIPAA does not apply in this situation where the hygienist who had left this practice, upon learning that the other hygienist had divulged some information about her, she immediately wanted to say, well, she violated my HIPAA rights. Well, HIPAA is designed to cover, as you said, electronic transfer of information, and it also covers covered entities, which are clearinghouses and employers and people like that. It really does not cover person-to-person information unless it is very, very sensitive information that was divulged as a part of that person being a patient in practice. In this situation, the coworker was not the patient of the other hygienist. So again, HIPAA just doesn't even apply at all in this situation.
You did refer to an expert by the name of Wayne Smith who writes about workplace privacy, and I wanted to read a particular section of what this author wrote. An employee may claim invasion of privacy when an employer discloses private and arguably embarrassing facts about an employee to a wide audience without permission. This was a one-on-one conversation with the patient who obviously liked the other hygienist. So, again, this is kind of a tricky situation, isn't it?
Yeah, it's a little tricky in that, first of all, this was not an employer divulging anything about a former employee. This was just a coworker having a conversation with a patient. So the workplace privacy issue would even apply in this situation. And the other thing, this information was not divulged to a wide audience. It wasn't like the employer was trying to disparage this former employee by telling a large number of the patients that thus or thus had happened. It wasn't that at all. What happened was that there was a patient in the chair, and she was used to seeing a particular hygienist. When she came to her appointment, this hygienist was gone, and the patient was upset that she had not been informed that this hygienist was not working there any longer. And I think that's very reasonable. So when she asked the hygienist who was seeing her, what happened to her, then this hygienist said, well, were you a friend with her outside the practice? And the patient said, yes, she was. And so this hygienist said, well, my understanding is thus and so. And she said, you need to just check with her when you see her. And she kind of left it at that. So I don't know what was going on under the current there, but it's possible that this hygienist had not been fully forthcoming about why she even left the practice to start with. So, again, all of this situation could have been avoided, Mark, if the front desk people had been proactive in informing patients before they came in that their favorite hygienist was not going to be there. I think it was a real breakdown in communication on that end.
Well, another point that you discuss in your column, and I don't know how big of an advocate you are of this, but you talk a lot about, you talk a little bit about when a hygienist leaves the practice, it should be okay for her to communicate to her former patient about her departure and give presumably whatever reason she has for leaving, or discuss what she wants to discuss. Do you believe that hygienist should be able to notify her former patient?
Well, Mark, you have to be careful with that. Now, when hygienists leave under very positive circumstances,